It's actually quite simple because I do it every day. So basically, the patient will be under twilight anesthetic and a local anesthetic. Now, basically, what the local anesthetic does is that it numbs the area and it loosens the fat and it constricts the blood vessels so the patient doesn't get too much bleeding. And through a tiny little incision, about 2 to 3 millimeters, we insert the tube, and that tube will suck the fat out. It sounds simple, but it's actually not as simple as that. Okay, it's an art form. It's like sculpting a patient. We want to sculpt it so that the patient get a good result and an even and a smooth result. The most common areas, obviously, for men is upper and lower tummy and the hips. For ladies, tummy too, as well as the thigh area. And in some older ladies and men, they have their double chin done. If you're under anesthetic, obviously you don't feel much, okay? But post-operatively, a patient feels as if they have done about 200 sit-ups if they have their tummy liposuction. But basically, it's just a bruised feeling. And normally it lasts about 1 or 2 weeks. And most of my patients just take about 2 or 3 days off from work. They do not need to take weeks and weeks off. There are a couple of non-invasive ways of removing fat. For example, there's cool sculpting and there's cool shaping. Unfortunately, it still does not produce the result like what liposuction does. Liposuction is still the gold standard in fat removal. For example, we also do cool sculpting or cool shaping. The result that we get from that is probably just half of what we get from liposuction or liposculpture. Because cool sculpting or cool shaping takes a long time to do, for example, it can only cover just a small area each time. By the time you add up all the costs of cool shaping or cool sculpting, it's almost similar to liposuction. So with liposuction or liposculpture, patients just come in just for one session and that's it. They get the maximum result from this one session.